We're very fortunate that we sit in an area with lots of resources, but the one thing that the medical field hasn't figured out yet is how do we help folks when they can't get out. So if you can get into the hospital, great, there's a lot we can do, but if you can't get out and you can't get to your doctor's office, what do you do next?
The first program we had, Mom got really sick with pneumonia and wound up in the hospital because I couldn't get anybody to come out to see her.
We'd call, and 2 or 3 days maybe somebody would call and you'd say what the problem was, and it would still be 3 or 4 days or a week before you got any answer. And the pneumonia left me so weak that I can't walk by myself.
We found somebody else and had them for about 6 months, and then they went out of business. So I was beside myself because there was no way that Mom could get out for anything unless an ambulance picks her up and takes her and brings her back.
The Support Our Elders program, I think, was born out of the recognition of that need to go where the patients are.
Mrs. Langstrom was referred to the program actually by her daughter. She happened to talk to a lady at Towson Medical Equipment whose mother is also in the program, and in the course of conversation this came up, and so Ms. Langstrom's daughter Janice called our office and said, "I've heard about you, and how do I get in?"
I sent her records from the previous healthcare group, and as soon as she got the records, I guess Beverly looked at them and she called and said, "Sure, we'll take your mom on," and that was the best thing that ever happened.
With these patients, there's a connection, there's continuity, there's communication. We don't just treat the patient's cough. Beverly goes into the home and she treats the whole patient.
One of the unique things about this program is that our nurse practitioner, Beverly Ruiz, is very, very capable from the medical perspective.
What I like about Beverly is she gets right down in front of my mother and talks to her, because Mom doesn't always hear real well. And a lot of times caregivers will talk to me instead of to my mom.
Not as glad as I am. I bet. Someone's always there, no matter what time it is. Someone is always there to answer your questions and to help you. And Bev is way above anything I can say.
If you think about the cost of institutional care at $5,000 or $6,000 a month, imagine what you could do with that money in the home.
If you have to have home health care, you want somebody that you can trust and that you can have confidence in, and I do. If you trust your mother's care to somebody, you want it to be somebody like Beverly and the people at GBMC.